Sleep and your heart, how to improve sleep hygiene. Hello and welcome to this video guide exploring the importance of sleep. My name's Tom and I'm a cardiac rehab nurse at Southmead Hospital. In this video I'll talk about the importance of sleep for heart health and how you can improve your sleeping habits. I'll include data from research, experiences from cardiac patients and tips to help you improve your sleep. Overview. This video will cover the following topics: the importance of sleep, an introduction to sleep hygiene, what to do and avoid for healthy sleep, and tips for changing your sleeping habits. If you have any concerns about your heart condition, please speak to your GP or your cardiac team and look at the information on our own website and the British Heart Foundation website. Importance of sleep. Sleep is vital for overall health and for quality of life. The benefits of sleeping well include improved mental functioning, stress relief, healthy weight maintenance and good immune system function. It's also important for heart health. Sleep allows the heart and the blood vessels to rest by reducing heart rate and blood pressure, which helps to keep them working well and reduces the chance of illness. Not enough sleep or poor quality sleep can affect heart health. Research shows that problems with sleep are very common for people with heart disease. As many as 44% of people can be affected, or 50% after heart surgery. Sleep is essential during recovery, so it's important to address any difficulties with sleep and think of ways to tackle the problem. We will now hear what some of our patients had to say about their experiences with sleep.
My name's Ian Clapp. I'm 70 years old. I actually still work, and I work too hard. I run a hotel and a spa. I'm sort of busy, which I felt the stress probably brought on my heart attack. But we'll see. For my particular case, sleeping is probably something that because you're in a little bit of pain or whatever, you've got a few more disturbances. I get cramp in my leg a lot, whereas I didn't used to get cramp. So it sort of wakes me up in the evening. So it's sort of difficult. So I now find I wear a long sock where I had my bypass, and with that it helps me not getting cramp because you keep warmer, and if you keep warmer I find you can sleep better. So I think warmth is a good thing.
My name's John Charles Kirby. I'll be 71 this year. I've worked all my life and I retired in 2019. So my father died of a heart attack at 49. And so I have a heart attack, but I'm a bit older. But I was scared to go to sleep. I just didn't want to go to sleep. That's why my father died. He had a heart attack. And then he just went to bed one day and didn't wake up. And so I was imagining that might happen to me. I've had it all my life, but not as bad as what it is now. I can sleep for a couple of hours and then wake up and I'm wide awake. And I try to stay in bed, but what you do when you're in bed is you pick up your phone, don't you? And which I think might make me worse, but that's what I do. And where I'm retired, I can fall asleep anytime. It doesn't matter to me. And so I don't worry about it.
Sleep hygiene, what is it? Worrying about your sleep can make it more difficult, but there's lots of things you can do to reduce the impact of sleep disturbances and improve your sleep quality. Sleep hygiene is a term used to describe sleeping behaviours, all the habits and things you can do that can affect sleep. This mainly includes what you do before bed, such as what you eat, drink, do to relax and so on. By changing some of these small habits, you can create a regular relaxation routine and give yourself the best foundation for a good night's sleep every night. Sleep hygiene, what to do and what to avoid. So what kind of things can you be doing before bed? Well, it's about finding what can help you wind down and get ready to rest, and then dedicating time every night to this relaxation. Some good activities to do in the hour before bed include reading, listening to relaxing music or a podcast, showering or bathing, and meditation. It's important to try and avoid screen time on your mobile phone, computer and tablet in the hour before bed, as this also stimulates the brain. It's also useful to go to bed and wake up at the same time, even on weekends. This makes it easier for your body to know when it's time to go to sleep and when to get up. Try and find a relaxation routine that works for you and make sure to do it every night, including weekends. Some apps can help you, including those that cover meditation and track your sleep, so have a look around and see what works for you. What are some of the behaviours you might want to change? Well, the hours before you go to sleep are important. It's a good idea to avoid large meals, nicotine and caffeine close to bed, as these can stimulate the brain and make it more difficult to relax. It's also good to avoid alcohol, as although this can make us feel sleepier initially, it leads to poor quality sleep and waking up in the night. Although regular daily exercise is very beneficial for sleep, and you should certainly try and work this into your daily routine, try to avoid doing strenuous exercise in the 90 minutes before you can go to sleep, as this makes it difficult to switch off. How to implement actionable tips and plan. It can feel overwhelming to change your daily routine even when you're confident that it will benefit your health and quality of life. When changing some of your habits, it's a good idea to start small, even if there are multiple things you might want to change. Start with focusing on one habit, such as avoiding screen time before bed. You can make small changes, such as charging your phone in the corner of your room or in another room altogether, and keeping books next to your bedside in its place. For any habits that you may want to alter, try and find some guidance online with tips to make the change easier. You can find a list of sleep-related behaviour tips on the Sleep Foundation website, with advice on how to make small changes to improve your sleep. Closing message and further support. While there are things you can do to improve your sleep quality and reduce disturbances, it's important to seek help from your GP if sleep difficulties continue after improving sleep hygiene, and if this impacts your day-to-day activities. A selection of further resources and support will be listed along with this video on our website. Sufficient, good quality sleep is essential in your recovery from a cardiac event and for your health overall. Sleep hygiene refers to a number of tips that you can follow to help you achieve the right amount of sleep. These tips include bedtimes, relaxing before bed, avoiding screen time, and waking up at the same time each morning. If you're still experiencing sleep difficulties after improving sleep hygiene, it's important to reach out to your GP for further support.